So yeah, good morning everyone. Thank you for joining us. Hopefully you're all managing to keep slightly cool in some way because it's still absolutely roasting out there. Basically for today's session, Isabella has really kindly agreed to do a session talking about her current PhD studies on speaking up experiences of radiographers with regards to patient safety concerns. So I won't really do too much of the talking. I'm going to pass over to Isabella. She has agreed to answer some questions at the end as well, if that's still okay with you, Isabella, just in case anyone is interested in kind of postgrad study with Cardiff eventually as well. So I'll pass over to you. Thank you so much for doing this session. And if you need any help with sharing your screen or anything, just let me know.
I actually do, because
okay.
I'm used to using Zoom and not Teams.
Okie dokie.
Oh yeah.
So you should have a bar along the top, which is where you can kind of leave, and then you've got your camera and your microphone.
Yeah.
So next to that is a little box with an arrow in it.
Okay.
So if you click on that, okay, that should allow you to choose whether you share the presentation or share your screen, or one of those. So hopefully if you try that, and then we can let you know if we can all see it.
Okay. Let me try that now. Okay. Are you able to see?
Yeah, we can see that.
We can see it. Yeah.
Okay. Okay. So I guess I'll just start now, if that's fine by you.
That's absolutely fine. Yeah, thank you.
Okay. So just a little introduction. My name is Isabella. I am a postgraduate researcher with Cardiff Uni. I'm currently at the end of the second year of my PhD. So I'd say I'm at the bridge of second year and third year. And I am a radiographer, practiced for about 5 years, and then I came on to do my PhD. So basically, the topic is speaking up for patient safety, exploring the experiences of the Ghanaian radiographer. I guess that already tells that the study is based in Ghana. And it's a qualitative exploratory study, and my supervisors are Professors Ale Jones and Daniel Kelly. So this just gives an outline of what the presentation is going to be about. So it's basically a little background and introduction on the topic, research aim and question, my study design and methods, my early findings. I included some data extracts and my reflections, basically. So I don't know what this picture means to you, but it's just me having fun with the topic. So basically, speaking up is used interchangeably with raising concerns and internal whistleblowing. So people use these terms to sort of mean the same things, even though technically there are some differences. And for this presentation, I would say that speaking up can be explained as raising concerns about unsafe or unethical or poor practices or poor quality care by employees to persons in roles that may suggest their ability to effect some form of change. And so for the purposes of this presentation, I would refer to speaking up and raising concerns. So wherever you hear these terms, they mean the same things for this presentation. And patient safety is mainly concerned with avoiding unwarranted or avoidable harm resulting from actions taken, omitted, or decisions made during the healthcare delivery process. And I think all of us are familiar with how a radiography department typically is. So we know that a typical radiography department has a large number of patients and there are diverse procedures. And so it involves communication between different people. And there are studies that have shown that communication between radiology staff and other health professionals is like a major risk to the delivery of safe and effective healthcare. So it's not something that can be overlooked, if I'm to say. And speaking up also has been shown to make some great contribution to ensuring patient safety in some settings. And so, focusing on speaking up now, globally, we know that speaking up has been sort of a difficult topic to manage, and it's quite difficult and toxic as well, because even in the UK, talking about experiences from the Mid Staffordshire report by Robert Francis, the Gosport War Memorial, and these are just few examples. It tells you how toxic and how sensitive some of these things around speaking up could be. And so interventions that have been developed in healthcare, some healthcare settings internationally have not really, we can't say much about its success. We can say that it's variable because in some settings it's probably more successful than others. But yeah, so some people have had interventions, but the success rate is really variable. But my literature review revealed that in Ghana, speaking up is totally unexplored. And even in the UK, I realized that in radiography, it's not really a topic that has been researched on. There's a lot of international literature in nursing, in medicine, among nursing students, medical students, but there's not much on radiographers or radiography students, if I'd say. And so I realized that there's that gap in understanding, and we cannot assume that things that have been researched in other fields are same for radiography, because even though it's all healthcare, there are differences. And in low and middle income countries like Ghana, a lot of the work on speaking up and whistleblowing has been focused on financial corruption. So most African countries sort of have speaking up policies that are targeted on corruption in the finance sectors, where you talk about politicians embezzling funds, talk about people spending money that is meant for like the masses and all of that, but it's not really focused on healthcare. And even with these policies, there's like there's been little success with all of the things that they've done in low middle income countries like Ghana. So this is how Ghana looks. I don't know if the map is beautiful. I want to believe so. But basically, Ghana covers a land mass of 238,535 kilometers square. And it's in West Africa, bordered by Togo in the east, Ivory Coast in the west, Burkina Faso in the north, and the Gulf of Guinea and Atlantic Ocean in the south. So Ghana is fairly a small country, and I'm talking about Ghana because my study is based in Ghana, so I feel that it's useful to give some background. And so the yearly growth rate of Ghana is basically 2.15, and a population currently stands at 31.2 million, with different languages, different ethnic groups, different religious groups. And Ghana administratively has 16 regions, as illustrated in the diagram, the map. So healthcare in Ghana, just like everywhere else, is focused on improving access to quality, efficient, and seamless healthcare, irrespective of gender, to everyone, basically. And it's mainly controlled by the Ministry of Health. So the Ministry of Health in Ghana sort of develops policies, and these policies are sort of administered or they are implemented by the Ghana Health Service. So it's like an umbrella, sort of. And basically, I just want to give a flavor of what the distribution of healthcare access is in Ghana. So we have 16 regions, but there are only 10 regional hospitals, and there are 172 district hospitals in Ghana, although we have 260 districts. So it means that there are districts that don't have district hospitals, and some of these things are under being developed currently. There are 6 regional hospitals currently under construction, and yeah, that's basically about distribution. Healthcare professionals in Ghana, like everywhere else, are ethically and legally accountable to their patients. So we have the patient charter that talks about a patient's rights and responsibilities, and it also talks about the health workers' rights or duties towards the patient. However, there are no specific guidelines that sort of exist to regulate practicing radiographers in Ghana in their patient advocacy role. So apart from the patient charter, there's really nothing else. There's no policy for speaking up by the Ministry of Health or the Ghana Health Service that really sort of directs a radiographer on what to do when you feel that a patient is being harmed or a patient's safety is being compromised. We, however, have anti-corruption laws in Ghana, such as the Whistleblowers Act, but our Whistleblowers Act is an anti-corruption tool, basically, for financial corruption, and it's not really focused on healthcare. So this slide talks about radiography in Ghana. And it's been 90 years since radiography was introduced in Ghana. I want to believe it's fairly young because there are countries that have practiced radiography for longer years. And even in Ghana, professions like nursing and medicine have been around for quite a longer time. And there are currently 5 teaching hospitals in Ghana equipped with MRI scanners, CTs, X-rays, ultrasounds, and all of that. There are hospitals in Ghana. There are some specialized private hospitals that do advanced things like cath lab. But we don't have PET scan in Ghana. But there are some facilities where you can even do interventional radiology. I know some people think that there's nothing like in Africa, but there are. And there are district hospitals that have ultrasounds and conventional X-ray machines. There are CT scanners in 9 of the 10 regional hospitals. And a lot of private facilities are also around where they have these equipment. So basically, yeah, there are a number of radiology equipments in Ghana. So radiological services in Ghana are mostly self-funded, and unlike this set in the UK where it's covered by the insurance, in Ghana people literally have to pay to access radiological services. So if you need an MRI scan, you pay for it. If you need a CT scan, you actually pay for it. So there are people who need and sometimes do not get access because they can't afford. And there are no clear-cut guidelines for raising concerns on patient safety compromises by the Allied Health Professions Council and the Ghana Society of Radiographers. So the Allied Health Professions Council is like HCPC in the UK. Yeah, so they basically regulate all allied health professionals. And the Ghana Society of Radiographers is basically like Society of Radiographers in the UK. So this is me. And yes, I'm speaking up for safety. So why I chose the topic, 2 reasons. First off was my personal work experience. So I know that every time you share your topic with someone, the first question is, why did you choose this topic? Because most people want to know, why are you doing this and not that? And I chose speaking up because throughout my practice, I observed things go wrong in terms of patient safety and no one speaking about it. And during one instance, I realized that a patient came in to do an X-ray, I think of the lumbar spine, and was handed a report for X-ray of the left ankle, which was clearly wrong. Because what happens in Ghana is we don't have the PAC system in most facilities. So basically, when you do an X-ray and you need a report, you take your X-ray home, we give you a date for your report, and then when it's ready, you come back to get your report. So this patient did the X-ray, went home, came back, and was given the wrong report. So I quickly went to the radiologist to sort of draw his attention to the fact that, oh, I think there's been an error in this patient's report. I don't know if it can be rectified. And the response I got was terrible. Like, he basically just shut me up, that I'm just a radiographer. So how dare you say that I've made a mistake? How dare you? And it's not like I went to confront him, because I believe that mistakes are inevitable in our healthcare system. And we are human beings, we are not machines. And so definitely things like this would happen. But the big thing is how these things are handled, like what you do when mistakes happen. So he basically just said, I do not have any right to say that he's made a mistake because I'm just a radiographer. He's a radiologist. I was like, okay, fine. And it made me really sad, because why would you work in a place where you don't have a voice? If something goes wrong, then you cannot speak up. You just sort of act like a robot, obey instructions, just go around, and that's it. And so it made me interested in the topic. And I kept wondering that, does it mean that there are radiographers like me in other facilities who have had some of these experiences? And I'm sure there are some that could even be worse, because we know radiography deals with radiation, there are issues about infection, there are so many things that could literally go wrong. And so if there are radiographers in other places who have these kind of stories to tell, and they basically don't have a voice, then it's something worth investigating. It's something worth finding out about. And so that was what brought the interest. And so I did a bit of background reading, and I actually realized that this topic has actually not been explored in Ghana. So then it made me more confident about wanting to take something, take that up as a project work. So I was basically waiting to get an opportunity to do a PhD, and then and then it happened, and I'm here. So the aim of my study, basically the aim of the study was to explore the experiences and perceptions of Ghanaian radiographers in speaking up on patient safety concerns, with the overall goal to improve practice, patient safety, and to inform policy and education. My research questions. So there are 6 of them. And the first is, what do radiographers in Ghana understand by the concept of speaking up for patient safety? What is the willingness of Ghanaian radiographers to speak up about patient safety concerns? What are the factors affecting speaking up behaviors of Ghanaian radiographers? What are the experiences of Ghanaian radiographers with institutional culture and interprofessional relationships when speaking up about safety? Do Ghanaian radiographers have speaking up training needs, and are there procedures, policy, guidelines on speaking up in hospitals in Ghana? And if there are these policies usefully guiding radiography practice? So these are the questions I sought to answer with my study. So this is me trying to find answers to my questions. And that brought me to my study design. So I chose a qualitative exploratory approach because it assumes the broad characteristics of a qualitative methodology. And I chose it because it offers a lot of flexibility when you don't know much about the topic and there's not been previous research in the place you're trying to investigate. And so it sort of allows you to basically explore. And so I didn't seek to generate theories or anything, but I just wanted to explore. And so that was my study approach. So basically, because of the exploratory nature of the design and the significant knowledge gap in my understanding, that's why I chose this approach. So we all know that for a typical qualitative research work, the main data collection tool is interviews. Like, unlike case studies where you could add documents and observations. But we all know speaking up cannot be observed, because I don't know how you go about observing how someone goes to raise a concern. But so I chose interviews. And how my interviews were done. So face-to-face, basically one-to-one, semi-structured interviews. My participants were selected purposively. So participants were basically from different healthcare providers. So teaching hospitals, other public and private hospitals in selected regions, and some stakeholders in policy and regulation. So in all, I interviewed 24 people. 21 of them were radiographers, and 3 of them were stakeholders involved in policy and regulation. My interviews were audio recorded, and I did not choose focus groups because I felt that speaking up, the act of speaking up, is already sensitive on its own. And so to want someone to tell you about their experience, I didn't think that focus groups would do justice to it, because some people just wouldn't feel comfortable sharing some of these experiences with other people being around. So these are my participants. And that brought me to my data analysis. So before data analysis, I did the transcriptions, and I must say that it was a very painful process, because I wanted to do them myself because I wanted to immerse myself in the data, and I felt that it was a good opportunity to become more familiar with what the data was presenting. I didn't think that I would appreciate it if someone else did it for me. And so, as painful as it was, I did it myself. And I analyzed my data using NVivo, but I did some manually as well. So it's basically a combination of NVivo and manual, because NVivo organizes the data, doesn't analyze for you. You still have to do the work yourself. So it was basically thematic analysis, and I used Brown and Clark's 6-step process, which I've illustrated in the diagram. So from familiarizing yourself with data to generating codes, searching for patterns, reviewing your themes, defining and naming themes, and producing the report. And this process is not easy at all, but yeah. And so that brings us to findings. And my analysis generated 3 broad themes. And so my first theme talks about the divergence in understanding and perceptions of speaking up and patient safety. My second theme talks about workplace barriers and facilitators of speaking up or raising concerns. And my third one talks about the current strategies in response to those barriers and facilitators and future directions. So these are my themes, and they are seated nicely here. So before I talk about the themes, I think it's useful to give a little context so that everyone knows what some of the situations confronting these radiographers, like prior to talking about the themes, because it's always useful to describe your context before you talk about what came out of the data. So this talks about the challenges of radiography practice in Ghana as presented from the data. So it's basically what radiographers who I interviewed have to deal with in their practice. And I believe that it's useful to do this because some of these things could, in effect, sort of play a role in their decision to speak up. A radiographer's speak up decision trail could be influenced by some of the challenges faced in their practice. And so it's useful to talk about these things as well. And so the first one I would look at talks about improper regulation and radiation concerns. Like radiographers I spoke to were unhappy about how the profession is being regulated in Ghana. So the thing is, the regulation of radiographers in Ghana is, I'm trying to find a good word to describe it, but there are people who are practicing as radiographers and are not qualified to practice as radiographers, basically, because the council was introduced not too long ago, and the introduction of radiography practice was more of on the job. They didn't, before they introduced it, they didn't really have schools to train, although it's not the case now. But a lot of those quacks are still in the system. And so some of them are not regulated to practice. And then there's an influx of people from the universities as well. So it's like a mixture. So there are people who are qualified, there are people who are not, depending on where you find yourself. And some of these people are in the rural areas, the deprived areas of Ghana, because a lot of the young rats do not want to go to these areas because they want to be in the big cities. And so you have people going there, and it's a thing of concern because it's a safety concern in itself. If you have people who are not regulated handling radiation, it's a big issue. And then there are radiographers who have issues of recognition. So they feel that there's a lack of recognition for their profession as radiographer. They don't feel respected enough as radiographer. They feel that doctors sort of lord their authority over them and they're seen as just radiographers. And so a lot of them expressed displeasure with the kind of recognition they had in their role as radiographers. There are issues with equipment procurement and maintenance. So some of the radiographers told me that the way radiology equipment are procured in Ghana usually do not follow the rules that are supposed to be applied. And so they bring in equipment without any maintenance plan. And so it's installed nicely until it breaks down, and that's it. And these things happen very often. And so basically you go to a facility and they have radiology services for say 3 months, and then for the rest of the year it's gone until they get another equipment or they get a donor or something miraculous happens. And there are issues of workforce shortages and poor conditions of service. So basically radiographers and the population of radiographers in Ghana now stands up at about 346 for a population of 31 million. And so I'm sure you can imagine how crazy that seems. But if you have 347 radiographers and sonographers having to manage a population of 31 million, then you know that there will definitely be issues. And so most people have to rally around facilities trying to make up for the workload. And so that is also a challenge. And then the poor conditions of service. Radiographers feel that their salaries are not good enough. I don't know who is ever pleased with salaries anyway, but they feel that they should earn more than they are paid as radiographers. And then there's the issue of lack of specialization and role extension pathways. So the way radiography is practiced in Ghana is quite different from what is done in the UK. So I know in the UK, you can decide to specialize, become an MRI specialist, CT specialist, mammography specialist. Basically, you can branch into all sorts of fields. But in Ghana, we do everything together. So basically, you go through the 4-year degree program in the university, and in your training, you have bits and pieces of CT, bits of MRI, bits of everything. So when you graduate as a radiographer, you are not a specialist, you are a radiographer. And we don't have schools that train you to be a specialist. And the healthcare setting or the system does not recognize you, even if you go outside to specialize and come back to Ghana. So even if you came to the UK to say do reporting and you came to Ghana, you're still a radiographer. It won't change your salary, it won't change your role, it won't change anything for you. So people learn to do the scans based on where you work. So if I left school and I went to a facility that had MRI and CT, then I'll automatically be trained in those areas, and then I can add those to my CV. But you don't actually have like a paper qualification to say that specialized in this field or that field. And a lot of the radiographers expressed a displeasure about these conditions because there are quite a number of radiographers who have had the opportunity to travel outside to train and specialize, and then they come back to Ghana and it's like nothing ever happened. Even if you went to do a PhD and you came back to Ghana, you're still a radiographer unless you decide to branch into academia or something. But in the clinical setting, we basically don't have specialized roles for radiographers. And then there are concerns about education and training, where people feel that they are not supported enough to pursue higher education in radiography because already we don't have many schools in Ghana doing radiography. And if you did radiography and you say you wanted to do advance into other fields, you would have to go outside and bear your costs, basically. And so we don't have, say, scholarships that are readily available for radiographers who, say, had an interest in pursuing that kind of education, unless you find a way to get it from another agency or something. And so these are basically a summarization of some of the challenges that radiographers in Ghana have to deal with in their practice. So let's go on to the themes now. So theme 1, and I've tried to make this as concise as possible. So theme 1 basically talks about the divergence in understanding and perceptions of speaking up in patient safety with 2 broad sub-themes which talk about, so the first sub-theme talks about knowledge about speaking up and whistleblowing. And this basically summarizes the knowledge or perceptions radiographers in Ghana have about speaking up and whistleblowing. So it talks about the formal and informal knowledge, the fact that there's lack of formal knowledge because these things are not taught in schools in Ghana. No one teaches you in radiography school or anything. No one says anything about what to do when you have a concern or what to do when you see something go wrong. It's basically pure radiography curriculum and that's it. So you don't get to hear things like, oh, if you felt that there was something wrong in your department, this is the procedure to follow. And so people's perceptions about speaking up and whistleblowing is basically based on some of the things that they've heard. So I talk about sources of informal knowledge here because that explores how people have the understanding that they have or the perception that they have about speaking up. So some people have some understanding of speaking up because of their previous experiences. Some do because of hearsays. Some do because of culture. And yeah. And so moving on to the second sub-theme, that talks about the influence of the African belief system and the Ghanaian culture. And from my literature review, I realized that speaking up means different things to people in different cultures. And so you may be in the UK and think that, oh, it's okay to say this when you see it. It's okay to say that. But you go elsewhere and it's prohibited, really. It's not allowed to sort of say what you see or to want to question norms and things like that. And so the influence of the African belief system and the Ghanaian culture also came up in my data, the data I collected basically. So a lot of the radiographers told me that they believe that the way we are brought up as Ghanaians, so I'm talking about the Ghanaian child upbringing now, the way a typical Ghanaian child is brought up is not one that sort of encourages you to want to question things that go wrong. Because in a typical Ghanaian home, you are told that the elderly people are always right. Your mom and dad are always right. They can never be wrong about anything. And so it doesn't matter how you see it. It doesn't matter how anyone else sees it. They are right because they are elderly. And so most Ghanaian children sort of grow up with some sort of, I won't say it's timidity, but you sort of have that inherent fear in you when you try to ask your dad, why did you put my phone in the sun? Or why did you do this? Or why did you do that? But you sort of can't do that. And if you do that, you're sort of seen as disrespectful. And so to be a good child, you sort of need to conform and not ask questions about who did what and why this was done. And then there's also the issue about the African belief system. So I don't know if you know about the African belief in voodoo, black magic, superstition, juju, witchcraft, things like that. So some people believe that they have that fear that if someone did something really bad, and whether it's going to harm a patient or not, you decided to say draw the attention of an authority or decided to tell someone or report that person, the person could harm you spiritually, could cast a spell on you, could curse you, could do something to you. And in Africa, we believe these things. So there are times that people get sick and is attributed to some sort of spiritual spell or some sort of evil curse or something. And so people sort of have that fear that why would you go reporting someone if they could harm you spiritually, even if you did it without anyone identifying you, they could find your identity spiritually and still harm you. And so yeah, so there's that. And then there's also the thing about the societal expectation and the national culture, where what society expects of you. Does society expect you to question people? Does society expect you to ask questions about why a senior radiographer did this? So you're a junior radiographer, and so you don't go questioning things that your senior radiographer did. So I know that there's a bit of hierarchy in there, but the Ghanaian culture is typically very hierarchical. There's a lot of respect for people who are elderly, and these things influence what people believe speaking up should be, or how people believe that speaking up should be handled or tackled. So theme 2 talks about workplace barriers and facilitators of speaking up. And this basically talks about workplace culture, individual factors, the efficacy of speaking up, and the workload or working conditions. So basically what I have captured with workplace culture is issues around victimization, issues around bullying. So there are people who won't speak up because they spoke up before and they've been victimized. There are people who fear being bullied. Then there's this hierarchy where you feel that if your boss is the one going to sort of sign you off for promotion and they did something wrong, how dare you? You wouldn't. You wouldn't try to want to say anything. And then there are also issues about absence of policies, basically, and all of that is captured under workplace culture. There are individual factors that talks about previous experiences, personal beliefs, and moral courage. So people would speak up because maybe they spoke up before and they got a good experience or a bad experience. So depending on what the situation is for whoever, it could be a barrier and it could be a facilitator. And then there's the efficacy of speaking up, where people want to know if speaking up actually yields results. So some people believe that why would you go through the pain to speak up if it wouldn't yield anything, basically. So if it wouldn't yield anything, then I wouldn't bother to speak up. Sorry, am I still sharing my screen because it's kind of changed here? Okay. So there's the efficacy, and then the last one talks about workload and working conditions. So issues around job satisfaction, increased workload, and the radiography role identification. So let's move on to 3. Oh, do I have a lot of time or I don't? So this is the last theme, really. It talks about the current strategies in response to the barriers and facilitators and future directions. So one part of this theme talks about the strategies in response to those barriers and facilitators that were talked about in the theme 2. And this basically talks about what people do currently in Ghana in response to speaking up barriers or facilitators. So there's a national mode which talks about the Whistleblowers Act, and I've already said that that act is focused on whistleblowing in financial corruption and not really healthcare. Then there are the organizationally mandated modes, which talks about things people do in their workplaces in the absence of policies. So some people basically just follow the hospital organogram. So if something went wrong, you basically go to the next senior person to sort of report to. Some people have heads meetings where they raise concerns. Some people have suggestion boxes in workplaces where if you felt that something was wrong, you just write on a paper and put it in a box. But we all know that there are deficiencies with some of these things, because if you're using suggestion boxes, then there are concerns about delayed reporting. When does that concern get reviewed, and when do you get a response? What is a plan for what goes into the suggestion box? Like, a lot of them could not say, all they know is you can write and put it in the box, but as to what happens after it goes into the box, no one knows. And there were actually people who believed that it goes nowhere. So there are also departmental or local level modes where some people had WhatsApp platforms for raising concerns. And then there are individually based approaches where some people would just speak up to another colleague or speak up directly to the person involved, depending on your level of courage. And then the second part of this theme talks about the speaker policy planning, where people suggested things like a national intervention, education and training agencies to sort of tackle issues around speaking up, and then local level approaches such as a speak up guardian, probably in Ghana. But one thing I know is, or one thing I realized was that all of these suggestions could be made, but you sort of need to really check if these things are culturally sensitive, because you cannot transfer sort of speaking up approaches from elsewhere into Ghana and believe that it would work. Or you cannot transfer speaking up policies from, say, the UK into Ghana. So the UK has a speak up guardian, doesn't necessarily mean that Ghana could work with a speak up guardian. So these are some data extracts that I included, and I would talk about the third one, which talks about the spiritual beliefs. So this person says that when you report someone, the person might even curse you, and in our culture we believe in curses, and so we believe that if someone curses you, it affects you. And so if I'm going to report you because I've seen you maybe abuse a patient, and my act of reporting that you either get punished or corrected will affect me being cursed or affect me in a negative way, then I would rather hold back on reporting. And then the second bit also talks about the Ghanaian child upbringing, where this person talks about in our homes, going up against your parents or older siblings is frowned upon. So that's culture and hierarchy right there, where you do not speak up because you are younger. And then workplace barriers. So people express a lack of integrity. This person says that it's basically a lack of integrity in our systems. People are just not sincere. And so they feel that putting yourself out there to speak up is like putting yourself at risk, because they don't believe that the system really works to protect who speaks up. And then there are issues about whether, so the second person talks about their facility where when you speak up, instead of the concern being addressed, they attack you, the person who spoke up, and you could get punished and you could go without being paid. So this person was actually a victim of victimization. Oh, no, has been victimized, yes. So he spoke up and he had to work without payments for a whole year because he spoke up. And so there are things like that. And these are basically just a few of some of the experiences. So things people have spoken up about The one in red talks about a radiographer who was trying to speak up for a patient who had been sexually abused by a senior member of staff. And it basically got silenced because that person was one of the managers of the facility. And he had to resort to taking it to the police. And so the first one talks about when COVID came, they said doctors were sending patients to them who had COVID, and they would mask the request forms, write different clinical history, because they felt the radiographers would send patients away for fear of COVID. And so if they knew that the patient was a suspect of COVID, they still wouldn't write it on the request form, forgetting that they're exposing everyone else to COVID. My reflections. Basically, most of the radiographers had a fair understanding of speaking up and whistleblowing. There were no written down policies in departments, and people had their own local ways of doing things. But in the absence of policies, there were suggestion boxes, weekly report writing, heads meetings, reporting to a senior colleague, and things like that. So I realized the major deficiencies in some of the speaking of strategies, because there were concerns about anonymity and delayed reporting, among others. Most radiographers expressed a lack of confidence in their hospital management in tackling issues when they attempt to speak up. And the Ghanaian culture, upbringing, and belief system cannot be overlooked in a radiographer's speak up decision trail, because before a radiographer, that person is a Ghanaian first. And the culture and some of these beliefs are things that bind us, and they are things that we grow with. And a number of radiographers felt that speaking up was a waste of time because they had concerns about the act not yielding results. And so that makes me wonder if speaking up is an act in futility. So thank you for listening. I know that you probably have questions for me, but I have 3 questions for you. So I would like to know what you think about my research, what this means to you, and whether you identify with this. And that's it. So thank you. I think I need to stop sharing.
Yeah. If you exit your presentation, you might need to bring up Teams again, and you should have a box with a little square and an X in it, and then hopefully that means you'll be able to stop sharing your screen.
Okay.
Yeah, lovely. We can't see it anymore.
Okay.
Well, thank you so much, Isabella. That was, I mean, I've certainly found that really, really interesting, actually, to hear from kind of your perspective of, you know, a culture that's completely different to what we have here. I found that so fascinating to learn about. Really, really interesting. What I will do, I will open it up to questions, because I think, Rebecca, you've got your hand up. Did you want to ask a question?
Thank you, Isabella. I think we might have met when you started your PhD studies.
You gave me a call around
at
the Heat Hospital.
That was so interesting, and it's just it's so multifactorial. It's not just as simple as, you know, if you say about whistleblowing and, you know, reporting. In our culture, we no hesitancy, but obviously we have no concept of a different culture. So that was just really, really eye-opening. So my question was, you know, I think we discussed it at the time. Is there a like a reporting system for incidents? Do you have? So when we have in, I would probably say in all of the hospital trusts, not just in Wales, but I'd say in the UK, we have a reporting system. So when we have things that go amiss, near misses, and they're also categorised from sort of severe to, you know, I've scratched my finger moving the X-ray tube, to I've actually dropped the X-ray tube on the patient. Do you know what I mean? So it's all sort of categorised. Is there any such system in Ghana?
Okay, so for the places that I worked in Ghana and for a few of the other places, which are mostly private facilities, there's an incident reporting log, but that has been limited to issues around equipment breakdown. So people basically log that when CT is not working, or maybe the console is faulty, but it's
Yeah,
not really this patient was overexposed. This
yeah,
patient, that such things don't get reported.
no.
This patient was given a wrong report, or they did a wrong surgery because they got those things don't get reported. So
Because,
it's mainly about equipment.
yeah, I mean, that's quite interesting because, you know, obviously we, as we kind of discussed before, they data mine all the incidents looking for trends and themes and sort of what we've had. And coincidentally is that because of this reporting scheme, we've had, you know, patients being x-rayed or having CTs when they've had one in the last month due to a series of failings. And based on the back of that, because of that reporting culture, one of the facilities are actually having an IRMA inspection by Health Inspectorate Wales to sort of say, look, you know, what is happening with your systems and processes. So, you know, it's a very robust reporting system, and it's very good for sort of signposting, look, there's something going wrong with this certain part. It's quite interesting to hear that they sort of concentrate on your equipment,
Yeah.
and not patients. Yeah. Do you think that might, if that sort of system was introduced and there was like less of an onus about whistleblowing and more about, you know, concerns or near misses, or this could have happened, do you think that might sort of help to not change the culture but sort of skew the culture so it's more skewed towards patient safety?
Yeah, so it's one of the things that my supervisors and I have spoken about, because I feel like it's one thing to introduce a system and it's totally another to see if it's actually going to work, because you have people telling you that my boss is, and I want to give him that respect. I won't question him. And so it means that if there was that system, there would be questions about what gets reported. Doesn't mean that they'll be selective in things that go into that system. Will it be dependent on who is involved? So some people get a free lunch, and yeah. So I think that the thing about Ghana is the culture makes it more robust. So it's you cannot readily transfer a system from a highly advanced country into Ghana. You sort of find out what really works for these people, what they would understand culturally, and not feel that they are being culturally not right, or I don't know, but yeah.
No, thank you, that's excellent, thank you very much. Yep.
Thanks, Rebecca. Again, you know, interesting questions, and still interesting to, you know, hear about the differences. You know, like you say, in this country, it's just, you know, we've got to say everything, we've got to report everything. And I just think it's fascinating that there are so many differences. But you know, I suppose this is why it's so interesting that you're researching this area, in the hope that maybe some changes can be brought about eventually. Martin, you've got your hand up as well. Did you want to ask a question?
Yeah, thanks, Isabella. That was absolutely fantastic. I think actually, though, I think we may have chatted about this before, Isabella, when I met you. I think power is an important concept. And although we have a well-established reporting structure in the United Kingdom in the sort of NHS, I wonder whether if I, as a radiographer, saw a radiologist doing something wrong, whether actually would I challenge that in reality, only because I feel that medicine has this significant cloak of power around it, and that they will cover each other's back to a certain degree. I think that's a significant challenge. And where you were talking about issues around the sort of African spiritual belief, I think the parallel is there. If I went to my radiology services manager and said, look, I've just seen radiologist X doing something wrong, my fear would be that my career would be affected because I was whistleblowing on a medic as such. So I think what you've talked about has got so many parallels to the United Kingdom. Even though we have this supposedly amazing system of reporting, I think there's still a fear at the ground level of that person going and saying, I have seen someone X doing this. And I think until we really get down to that, I think we're going to have some similarities to the system that you have, but really amazing. I think Teddy's got a question, Charlotte.
Yeah, Teddy, did you want to pop your mic on and ask a question?
Yeah. Hi, Isabella. You okay?
Hi.
Thanks for the presentation. Right. My question is more around like data collection, because I'm in the process of like starting my third year project, so to speak. Bearing in mind the difficulties and the barriers that you've identified in, I mean, like issues of like respect for elders and all that in Ghana, right? How are you able to overcome those barriers and encourage your participants to freely participate, so to speak, in your dissertation?
Okay. Thank you for the question. And I'm sure you've probably heard about insider research. So when you're a radiographer and you're interviewing radiographers, there's some sort of advantage because they see you to be one of them. So I think that if I were, say, a doctor, it would have been really hard because I don't think they would willingly want to open up to me. But that also should be tackled well so that you don't sort of get issues of bias, because then if they're too familiar with you, then there could be some form of bias. But I think that the fact that I was a radiographer sort of helped. And so I got like a good response rate when I sent out my invitation emails. Like people were willing to talk to me, maybe because they knew I was just one of them. Yeah.
Okay, thank you.
Lovely, thank you, Teddy. I can see Terence, you've got your hand up as well. Did you want to ask a question?
Oh yeah, hi Isabella. I'm actually from Ghana myself. I found this.
I can see from
I found this very interesting. The thing I wanted to ask is that you see how you said at the moment there aren't really any like official ways to be specialized in a modality. Is there anything being put in place currently to change that in the future? Because I'm actually like considering moving to Ghana like in the distant future. Yeah. But obviously I'll get specialized here first and then yeah.
Okay, so Terence, I don't know if it's unfortunate or fortunately, but I don't know of anything being done currently to sort of bridge the gap. So I was reliably informed that there were some communications about establishing a college of radiography in Ghana, and they were hoping that with that, then they could go into specializations and then hopefully transfer it into practice. But some of these things go through a lot of politics, and so I can't really, to the best of my knowledge, there's not been a change really. There hasn't. So I don't know if I should advise you to go or to stay.
All right, thank you very much.
Hopefully we'll get better in the years to come. Yeah.
Yeah. Thank you.
Thank you. I don't think anyone else has got their hands up at the moment. I'm conscious of time. I think I just had a question. I'm just interested to know kind of now, what are your next steps in your kind of PhD journey? I'm, from gathering all your data and everything, how are you now going to kind of move forward with everything?
Okay, so basically what I'm doing now is, so I have a paper on my literature findings that we are presenting for publication. It probably, hopefully it gets accepted soon. And what I'm doing now is basically writing up my findings chapters. So that's basically what I'm doing now. Yeah.
Okay. So I'm guessing like with each of the themes that you've picked out, are you then hoping to have maybe like separate papers for each of those themes that can be published and things like that?
Yeah, I do. So interestingly, I have the topics or the paper headings in my head, but I haven't put them down on paper. I sort of want to forge ahead more with writing up, because it's the PhD work first before anything. And then if I get a bit of free time in between, I would write a few more papers. Yeah, so.
Sounds a lot of hard work, but definitely rewarding, I think, at the end of it. Yeah, absolutely. I've noticed Jill's just put her hand up as well. Jill, do you want to ask a question? You're on mute. Yeah.
Sorry. Hi, Isabella. Thank you so much for that. That was really, really interesting and fascinating. And as a very aged radiographer, thinking back to my early clinical experience, I can appreciate how people feel about speaking up against radiologists and senior radiographers, because it was just like that when I was a junior radiographer. Nobody would dare go, excuse me, I saw something wrong here. But I mean, thankfully, things have improved, certainly in Britain, so much that I don't think radiographers would hesitate. If they saw something gross, it would be reported, no matter what the consequences. So thank you for that. Really, I wanted to ask how you managed to get permission to do your PhD, bearing in mind that radiographers are not highly thought of in Ghana. So how did you manage to make that breakaway and do your PhD?
Okay, so basically, I applied for permission from the Ghana Society of Radiographers. So basically, the Ghana Society of Radiographers have like an ethics committee that sort of handles issues around radiography research issues. And so you sort of need to argue your case, make a case with them, and make them agree to approve your work. So I did that, and they gave me the approval to interview the radiographers that I did. And then I applied for ethics with the School of Healthcare at Cardiff University. And that's how it happened for me. Yeah.
Brilliant. I think that's amazing that you managed to do that. Second part of the question is, when you go back, are you going to be able to implement any of your findings from your PhD?
Okay, so in my case, I'm hoping that my recommendations would be accepted, because I'm sponsored by the government.
Mm-hmm.
So I feel like if you would sponsor me to do a PhD in this field and I bring you my recommendations and you don't.
Absolutely.
So I am hoping that it won't be one of those research studies that get shelved and nothing happens. I'm hoping that it's really able to impact practice and bring some meaningful change to the current situation.
Thank you. Thank you, Isabella.
Okay, I don't think, again, anyone else has put their hand up. I mean, I'm guessing if anyone thinks of any questions afterwards, are you happy maybe if they email me, I can pass them on to you? Isabella, would that be okay?
Yeah, that's totally fine. And I want to say thank you to all of you for coming here today to listen to me. It's nice talking about your work to people. We don't get to do lots of that because of COVID. And so I'm really happy for the opportunity to get other people's thoughts on my study. And I just want to say thank you.
Yeah, no, I think I speak for everyone when we all say thank you as well. I think we've all learned so much from your talk, actually, and learning about your research. So thank you very much for offering to do the session as well. I think we really appreciate it. I will kind of bring the session to a close, though, if that's okay, because I am conscious of time.